There's a subject that seems to be on everyone's mind these days, and it has to do with female hormones. And I'm so pleased to bring to you this conversation on Health Coach Talk with two people who are visionaries, who are the real leaders in the field. They are representing a company that I think will transform women's healthcare. So let me tell you about Rose Mackenzie and Dr. Carrie Jones. Rose Mackenzie is the clinical manager at Mira, where she assists healthcare professionals in effectively integrating Mira's hormone monitoring tools into their practices. Rose is well equipped to provide education and support to providers and fertility awareness educators. Additionally, Rose brings nearly a decade of experience as a natural family planning instructor, specializing in the Marquette and symptothermal methods. Dr. Carrie Jones. Wow, she is a true leader. She is a globally recognized speaker, author, and educator in women's health and hormones with over 20 years of experience. A naturopathic physician and Menopause Society certified practitioner, she completed a residency in women's health and endocrinology, earned a Master of Public Health, and was among the first board certified by the American Board of Naturopathic Endocrinology. Dr. Jones has held leadership roles at Precision Analytical, which is the Dutch test, Rupa Health, and New Ethics Formulations, and is the host of the Hello Hormones podcast. I know you are going to really enjoy my conversation with Rose and Dr. Carrie. I am just so thrilled to bring to you the one and only Dr. Carrie Jones and Rose Mackenzie. Welcome to Health Coach Talk.
Thank you. Oh my gosh, we're so excited to be here.
Thank you. Well, let's talk. You are involved with Mira, which is what we're talking about today. And before starting this conversation, I got to tell you that when I look back at my experience with hormones was nothing. I mean, all the years of going to, OBGYN, getting, got my pap test, got my birth control prescription, goodbye, and did the home pregnancy. I had both my daughters in the 80s and did the home pregnancy test. That was it. Who knew from hormone testing what? And then, of course, I was that lost generation of baby boomer women who wouldn't go near hormone replacement. So why would you test hormones? It was like we lost them after menopause. So it's thrilling to be able to see the birth of a company like Mira. So let's start out by talking about hormone tracking with Mira. How does that work? How does that improve patient engagement and outcomes?
Yeah, I think we should just start with how simple it is. So I like to tell people you're going to go to the bathroom anyway. So you might as well just collect that pee and let's test it. So it's a first morning urine sample. We like first morning because it's naturally concentrated. You're not eating and drinking regularly while you're sleeping, and you're probably going to the bathroom less often. So we collect a first morning urine sample. You dip your wand into that urine, put it in the machine, and then it reads out the hormone values to you. And that, again, is completely different than what anyone really has been able to do in the past. We have not been able to see these four hormones of estrogen, LH, progesterone, FSH in a per day result. And of course, that changes everything.
Yeah. Absolutely.
So one of the things I want to just add to that. So I remember in the beginning of Mira, I remember thinking, if I could just test my hormones every day, being over 40, I'm perimenopausal. And I was like, some days are great, some days are not. Some days I know my hormones are up, some days I know my hormones are down. There's got to be a way. And my girlfriend said, well, don't you know Mira? Have you not heard of Mira? They just came out. And I thought, brilliant. So before getting to know Mira, I just went ahead and signed up, got my Mira ones and started testing. And it was so immediately helpful to get that feedback and understand what was going on day to day, but also big picture. And I think that's what a lot of women are missing, are looking for, no matter what they're going through with their hormones, whether they're trying to get pregnant, whether they have PCOS, whether they have terrible perimenopause, PMS, menstrual cycle issues. It really doesn't matter. This can give you that immediate feedback.
Sure. And that can tie into symptoms you might be experiencing that maybe doesn't dawn on you that it's hormones. And I was speaking with my daughter who went through the Mira testing and loves it. She's a raving fan, and she's 41. And she was talking to her contemporaries, her female friends, and so many of them said, well, they just went to their primary care doctor. They were feeling out of sorts, maybe brain fog, maybe a little depressed, and they were just given SSRIs, antidepressants, and they didn't ask at all about hormones. And so I think that this is what I love about Mira. It's really a way for women to take charge of their health. That they don't have to wait till they go to the doctor. They don't have to just be dependent on that provider, especially because it may be people are having trouble getting appointments. They're not getting the right treatment. And so these women that she was talking to, like it never even dawned on them, that this feeling out of sorts, mood issues might be because they were entering perimenopause and they're turning 40 and things were changing.
It could even be like histamine symptoms. Just right before all of us got on to talk, I was teaching and discussing how when estrogen surges, which is a normal thing, we surge, but then sometimes we can surge too much or maybe take even too much estrogen. It can destabilize a mast cell, which can cause it to release a lot of histamine. And now women might feel like they have the 7 dwarves of allergies. They're itchy, sneezy, puffy, weepy, all the things. Or they may have the brain fog. They may have the mood swings. They may have, histamine can show up in other ways. And we're thinking, oh, it's stress. It's my job. It's everything that's going on. I didn't sleep well last night. Then they may be thinking hormones, which is correct, but not realizing this, it's symptoms other than, you would never think, oh, my runny nose might be due to these surges in estrogen. My itchy skin, my puffiness, my brain fog, I thought was only hormones, but realize it's a domino effect. It affects everything in the system.
Yeah, oh, absolutely. And one of the things that, you were on a wonderful Ask the Expert webinar that we had for our students and graduate community, and talked about how, as you figure out different parts of your cycle, that you may need to eat differently, for example. So can you share so these are things that somebody can find out, like what phase they are in when they're doing the Mira testing?
Yeah, so as soon as they start testing, they can identify, are they in their follicular visit, which is the time leading to ovulation. That's the time when estrogen should be dominant. So we want to see that nice rising estrogen level. And again, that's normal and natural, but can cause some people adverse effects. And then when they move into their luteal, this is now after they ovulate. So once an egg has been successfully released, it creates a corpus luteum, which drives that high progesterone. That high progesterone changes dynamically everything about a woman's life, from how much she craves things, how she responds to exercise, her mood, her libido, everything is affected by that shift in those 2 hormones. So now in the luteal phase, we have a high progesterone time. And actually women's metabolic state changes. So they're at a time when they need more calories. They may not tolerate long spaces in between meals. So if they are intermittent fasting, that might not be the best time to do that, because what their body needs is different. And so once women can understand what hormones are meant to do, when they do them, are they doing the right thing at the right time, then they can start living within their cycle in a way that helps them to feel better, sometimes with just really small adjustments. I know for myself, when I was during my luteal phase, I will not skip breakfast. This is my first and only goal of the day. Don't skip breakfast. I immediately felt better in my luteal phase. And that's something everyone, very tangible. You can do it starting, tomorrow.
Yeah, I think this is huge because a lot of women beat themselves up. There's a lot of shame or guilt or anger or frustration of, I used to, right? how come last week or how come 2 weeks ago I could go longer, I could do the fast, I could lift heavier, I could run further, I could hit the PRs, I thought I could focus better, and now I can't. This is so frustrating. I must have done something. And you just switched from your follicular to your luteal. And as Rose said, in the luteal, like, this is the time that you can't skip, and you probably don't want to push yourself into extreme PRs, and you want to be gentler with yourself. It's nothing wrong with you. It's just what happens with the female cycle, but we're never taught that.
For sure, we were never taught that. And I remember when I was in perimenopause, first of all, there was no such term. We can say that. I remember we would have conversations like, I'm premenstrual, but not talking about perimenopause. And even menopause was talked about as the change. I remember my mother would say, I'm going through the change. And, but I remember my workout routine during that period. It was the same. It was the same. I'm going to go on the treadmill, run 5 miles, whatever it was I was engaged in at the time, yoga classes, dance classes, didn't matter. I had no awareness of, I knew when I got my period, but leading up to it, you could tell the days leading up to it, but nothing in terms of being able to measure this. And so can you talk about this? Because I think it is just such an advancement in women's health that Mira changes the way women engage with their own health, compared to previous options like what I had, which was nothing.
Yeah, I would say the first thing is that we do learn more about ourselves. Even, I've been a fertility awareness educator since 2015, and every year I'm still learning more and more. When I recently did a webinar with Dr. Sarah Hill, she talks about even thinking about as someone, maybe you're helping someone through addiction, which I had never even thought about. She said you can actually time how you help them based on what phase of the cycle they're in, because the addictive behaviors are much higher in the follicular phase when you're approaching ovulation due to the high estrogen. And so someone's probably going to fail more often in that first couple of days. So she talks about if you're about to do an intervention, to do it in someone's luteal phase, very specifically, because then they'll likely be successful for 2 to 3 weeks before they get into the hard next part of their cycle again. And I had never thought about that, how we could apply this in so many different ways within women's lives. And really, that kind of the sky is the limit, but the research currently is really far behind because research was not done on the different phases. And so they were typically studies were done on men, or they were done on women on birth control, or they were done on the early follicular phase when the hormones are generally low. And so we have not seen how women respond to different things in different phases of their cycle. So now that we're getting attention to that, I think we're going to see an explosion of, really what we have been needing to know for a long time.
I think even getting the phases of the cycle correct. I mean, Rose and I talk about ovulation. She mentioned Mira is so helpful at finding ovulation because women read the book. We read the magazine. Our little tracker app says day 14, day 14. Every woman ovulates on day 14. And I'd argue the majority of women don't ovulate on day 14 most of the time. Sometimes you might. But for the average woman, I bet it's a big gap. Somewhere between day 11 to 18 might be, depending on the woman and the length of her cycle. So going back to fertility, even if somebody is listening, trying to get pregnant or coaching for pregnancy, then we can see once we pin down ovulation, the chance of pregnancy goes way up. Or if you don't want to get pregnant, then the opposite, like we can avoid pregnancy. But we were all taught, again, day 14. So if you just cycle everything around that, like, it's no wonder there's so much frustration around understanding your cycle or trying to get pregnant.
Yeah, that is such a good point. And so many insights can be offered to women with this tracking. And I think one of the most important would be in terms of relationships, if they're in a relationship. For me personally, I think it's a miracle. I've been married 54 years, and it was during that period of perimenopause where, I was much more aware of issues with my husband and more fighting and looking back at that, that was probably the result of I was much more impulsive and being able to regulate my emotions, as opposed to having better higher level executive functioning, being able to think things through. And so I see that as something that you can recognize through this testing and know, okay, it's not the relationship, it's your hormones that are talking to you.
And they are talking loudly.
Oh, yes.
Yes. Yeah. Yeah. And it is coming at a time also where women are noticing body image changes, identity is changing in terms of their role. And so there are many issues. So it sounds like this is something that can be used for younger women who are still in their peak fertile years, as well as those in perimenopause and menopause. So how is it, or is it used for menopause and beyond?
So typically it's best used from puberty to menopause. If we think about what the testing is, it's a typically daily, or it can be less often, but we're looking at fluctuations of the hormones. And so when someone is before puberty or after menopause, their ovaries are not producing the estrogens and progesterones, and there's not that communication, of course, with the brain and the ovary. And so it's much more helpful to be using it when we expect patterns of changes in hormones. So again, puberty to menopause. Of course, we're researching utilization of our product in postmenopausal women, but a little teaser, researching it, nothing to share yet. So right now it really is from puberty to menopause. Again, I like to say anyone who has ovaries that still function, you are a good candidate for hormone testing.
Okay. So speaking of the range of hormone testing, I went through the Institute for Functional Medicine's courses and became a certified practitioner. Even I was actually the only psychologist that went through and got certified. And they've since changed those requirements for practitioners. But I just remember the hormone module, and the educators were talking about all the different ways you can test for hormones. You can have blood, you have urine, and then the different types. So dried, wet urine. Can you describe what, if someone is really confused about hormone testing, and also what are the hormones commonly tested? I think there's a lot of confusion around that as well.
Yeah, well, I think we could take this discussion a lot of ways. Of course, there's more hormones than we're talking about today. Today's focus on the reproductive hormones, and specifically what Mira can test is the estrogen, LH, progesterone, FSH. And if we're going to be very specific, we're testing the main metabolite, urinary metabolite of estrogen as E3G, and the main urinary metabolite of progesterone as PDG. So Mira is a fresh urine. You collect the urine in the morning, you dip your dipstick right in it. So typically what people associate is like pregnancy tests, or maybe a traditional OPK, like an LH test strip. But again, we're getting all four of the hormones and really seeing how they interact with each other. So that's very different than samples that you may collect, like saliva or urine that you collect and then send in. So those are maybe testing the same thing, but they're going out to a lab to read them, and then you get sent the results. And then if we compare to a serum level, well, blood or serum is a point in time right now, what is circulating in your bloodstream. And so that's wonderful data depending on what you need. But most people don't want to go get their blood drawn every day. And we know the hormones fluctuate. So it's really a snapshot in time of what's happening right now. So utilization for all of them in different situations really depends on what you want to do. And I know Carrie and I talk about this a lot, so I'll let her talk about the analogy of the forest versus the trees.
I always say that the single day blood spot, or blood tests, the single day urine, the single day saliva is like a tree. You're looking at a tree, and in a lot of cases we can look very up close at that tree. We can see a lot of different metabolites. We can see cortisol, we can see testosterone, DHEAS, metabolites of estrogen. We can get a lot of information, but it is just one tree. And in a lot of cases, for a lot of women, I want to see the entire forest as well. And that's the benefit of Mira. So Mira, because you can test those 4 hormone metabolites every day, I can now back up and see what is she doing to be more personalized to her. When does she ovulate? How high or low is her estrogen in the follicular and the luteal phase? How high is her progesterone? Does she even get a progesterone peak? And is it like a sharp peak, or is it like a bunny hill? Because the one-day test may tell me she's in range, but it doesn't tell me about the day before or the day after. Or maybe the one-day test tell me she's not in range, but we missed the timing of the test. If I'd waited a day or two, then the peak would have come. And they, just as Rose said, they both types of tests have absolute merit. There are over 50 hormones in the body. I mean, there's so many things that we can look at. But for a lot of women who wake up, you know, on a Wednesday and go, I don't feel good. Like, this feels hormonal. What am I doing? Then having tested before the days leading up, be able to test that day and the day after, now we can see a pattern. Now we can really step back and see what's going on.
Sure. And I liken that to getting blood glucose, fasting glucose. So
Yes.
Before I wear a CGM most of the time, and it's just night and day compared to like once a year you go get your blood drawn, and that's as if it's a sign you should wear. This is my blood sugar, and
Yeah.
people think that's set in stone. Well, it's changing every 5 minutes. Every minute it's different when you see the data from your CGM. And so realizing that, well, you know, like I would always get freaked out because it's typically maybe high when I do. There's certain times of day, maybe it's cortisol, it's stress of getting a blood draw, and then 10 minutes later I walk out and I look at my CGM. Wait, it's like totally different. So yeah. So talk about this whole field of remote monitoring and how that's really changing the landscape of women's health.
Yeah, well, patients love it, right? Users, consumers, that's why it's booming, right? We all want to know, how did I sleep? What's my heart rate? What's my recovery? And I think this is actually an amazing time because we have generally health conscious, data-driven people that want to make action on what they're finding. So they don't just want to track something. They're like, well, how can I live better because of this data? So we're seeing, it's really fascinating to see, you know, someone who has sleep and then they have how they're tracking their cortisol and then they have their hormones and they're like, oh, when I do this, this, and this cascading event happens and I probably shouldn't do that. That is not making me feel good. So it's, again, I love seeing, you know, for example, glucose data and hormone data together because patients can make sense of, like we were talking about earlier, that slight change in insulin sensitivity and resistance from someone moving to follicular into their luteal phase. That is a biological state that changes for this person, and they can proactively kind of counteract what their body is doing. And so they can eat differently, eat more often so that they don't feel so bad in their luteal phase. It's not like you just have to say, oh, you know, this is how it's going to be. Instead, it's I can take proactive steps to, again, take care of myself better and have a completely different experience of these cyclical events that, you know, often we just think this is what I'm stuck with.
I remember the first time I wore a CGM a while ago, I put it on my luteal phase, which was a big mistake. And I texted all my best friends and I was like, I'm on my way to diabetes. Here it comes. Like, this is, I don't know what I'm doing wrong. And then now being able to overlap, of course, Mira testing and be a lot more proactive. And of course, see how my stress impacts everything, my hormones and my glucose has made a huge difference. But I have had, since that time, I've had a number of friends who've texted me and say, I hate these CGMs. My blood sugars are like at least 10 points higher than I thought. I'm like, where are you in your cycle?
Yeah.
I bet you're in the luteal phase.
Yeah, absolutely. And what I have found is the impact of stress. If there's one thing that raises it more than anything else, I could, but it much more than what I'm eating. If I'm waiting to give a talk and I might see my weight, it's like really, really, it's a huge spike and stays elevated for a little longer. And a couple of years ago, I had gone to an acute care because I thought I broke a metatarsal in my foot. And so, and sure enough, they said, yes, this is broken. You're going to have to wear a boot for 6 weeks. And I looked at my CGM. It was like the high, I think it was like 200. And it was like, well, and that was the highest it had ever gone. And it had nothing to do with what I was eating. But on the reverse side, every time if I take a walk after dinner, I can just see it like plummet. If it was a lot, like go straight down. It's from maybe at like 125, 130, and by the end of the walk, it's at 80, 85, and it just so it's so validating in what works.
Mhm.
Doing squats, doing resistance training also does the same thing.
Yeah.
So looking at it, it's surprising, but it helps you feel like you're able to see it's like you're an N of one, and you can do these
Yeah.
experiments. Well, I'll see if I ate some grains and it had no effect. I always thought, well, I could beans. I thought I would get a spike, didn't. So it actually was the opposite. So it is really helping people take charge of their health.
And that immediately comes back to hormones too. Imagine
Yeah,
if you were high stress all the often, all the time.
yeah.
So all the time your glucose was high or borderline high. All the time your brain thought, well, we're about to fight a tiger. Here we go. Like, let me give you all this glucose and raise up your cortisol and your adrenaline. And because you can't make a baby while you're fighting a tiger, then that tracks back to now maybe your LH is low. You don't release the egg. You don't form a corpus luteum as a woman. You don't make a lot of progesterone, if any. So you can tie all this together to go,
Mhm.
oh, okay, on the Mira, my progesterone is not great. My LH spike is not there. My cortisol has been really high, been really stressed. My glucose has been borderline higher than it should be for me. And now, just as you said, Sandi, now you can take charge. Now you can make big life
Yes.
changes or even little life changes. It doesn't have to be overwhelming. And then eventually, in a month or 2 or 3, all of a sudden your LH spike comes back, and then your progesterone goes up, and then your mood feels balanced, and then you sleep better, and your energy's better, and all the things, right? It's so great to get that feedback and go, oh, it was me. I need to personalize these changes. And it's not always the person. I'm not saying that to blame people, but in that example of, chronically fighting the tiger, we can see how the spider web is connected.
Absolutely, that is such a good point, and that cortisol steal. So the cortisol, it's life or death. So you're not going to be making those sex hormones. Well, when the body needs the cortisol, and so it's such a key insight. And what I love in our work with you, Mira, is that health coaches can be trained to support people and have those important conversations to look at the data and then have a plan. What would happen if you did this, this, and this, and then when are you going to start this, and then help people stay accountable, but also not get overwhelmed, because when you are looking at this data, it is possible to freak out. And my daughter had that happen. She had the Mira test, and Rose, you got her through, but she freaked out because someone had said to her, "Oh, well, you just have no, you'll never, you have no LH, and you're just this is like flatlining, and it's a really big problem." And she was like freaking out, and that's sometimes a risk with getting all of this data from our wearables and our direct-to-consumer testing, that we don't know how to interpret it. And so we go to ChatGPT or Google, and all of a sudden oh no, I have this horrible terminal condition. So
that's why I love my role of educating clinicians, because I really see this drastically changing how we've addressed our clients, our users, our patients. And honestly, your client might say to you, well, I've tried, seed cycling, or I've tried phase specific something, but they probably were doing it in a way, well, I do something for 2 weeks and then I do it for 2 weeks. And that's not personalized to them at all. Because again, as Carrie mentioned, the typical window of ovulation, we say like optimal is between cycle day 12 and 20. And then next out would be like day 10 to 22, something like that. That's a big difference. If I ovulate on day 12 and Carrie ovulates on day 20, that's a completely 10-day difference of what we'd be doing. I'd be doing follicular phase strategies a lot shorter time, and Carrie would be doing them a lot longer. And so we really can personalize this to you. And so my challenge here is, if you're ever doing something that's one size fit all, well, it's not what's best for you. And if it's cyclical, but if it's not cyclical to you, then it's still not going to be the best for you. So we really have to get more granular here on how we're going to help you, not your sister or your friend.
Yes. Such a good point. So what do you see ahead? What's the future for Mira, and anything that I haven't asked you that you would like to talk about?
I think go ahead, Carrie.
The one thing I was going to say is going back to your daughter, Sandi, this is what I think is ahead. I think right now the people who are using these tests, these wearables, we are at the forefront of the tidal wave. And I think this will be commonplace, common knowledge, common understanding in the next 5 to 10 years. You know, like in 5 to 10 years, because it will be so much in our mainstream that when somebody sees the report, they'll at least have an idea of what to do or who to turn to, or it'll have been on their radar. Whereas right now it's just entering the radar, even though it's in our world, in the greater world, it is not. It is like, this is weird. This is interesting. This is so different. You know, this is cutting edge, but it's going to be more ubiquitous. I was talking with a health coach who's in her 20s the other day, and she said, oh my gosh, I just want to stay in my 20s. I don't want to be in my 30s. I don't want to be perimenopausal. It's going to suck. And I was like, no, girl, in 20 years, when you're perimenopausal, it's going to be the easiest thing ever. The easiest, because in 20 years, the research will be there. The functional medicine, how we address it will be there. The education will be there. Mainstream will be there. Conventional will be there. Like everything will be there in 20 years. It's just right now we're still riding that tidal wave, the beginning of the tidal wave.
Yeah. And to that point, I think I'm 75, soon to be 76. And I say, I love my life. And I say, I have actually more energy now. I have more muscle than I did when I was 30, 40, certainly 20 when I was overweight and binging on sugar. And so I think it's those lifestyle habits in combination with tracking, so that to know that you can take charge of your health, your genes are not your destiny, and health coaches can help you make sense of the data. So you have better data. It's available to you. It's not behind a prescription or behind a doctor's office wall. You can get this, and we're going to see tremendous growth in being able to interpret, and then health coaches are the guides and the support.
Yeah, you're the ones walking alongside of them as, again, they might be slightly confused by the data, or they have an idea, but they're like, well, I found this, now what do I do about it? And that's where my excitement comes in, is where I'm really hoping that we catch up with, well, what do we now do about it? I'm seeing it coming out. Again, I mentioned some of the work with Dr. Sarah Hill, other researchers who are very purposefully choosing to do their research with Mira as well. So we have about 20 researchers right now using Mira in their research for various different things, from how sleep apnea changes throughout a menstrual cycle to how do we treat PCOS better, endometriosis, menstrual migraine. So from treatment all the way to, again, still those like observationals. Well, we can kind of piece together that sleep apnea would change throughout the menstrual cycle because we know respiratory rates changed. So, we kind of know that, but I'm starting to see the research. And the second thing that's exciting for me is really where collaboration and integration is happening now. So we as Mira are happy to be collaborating with other wearables so that we get, again, that like compilation of data that then is more empowering to the user. So combining hormone data with sleep scores and heart rate variability and recovery, and seeing, again, all of those, because it's the whole person. We have to look at the whole person, not in little silos. And that's, again, where the hormone data is integral piece, but we're very open and honest and say it's not everything. You can't just track your hormones and think, this is it. You have to consider the interplay of everything within your life.
Absolutely. Well, this has been just such a fascinating discussion, and I'm so excited for the future of women's healthcare. And you are certainly at the forefront. So thank you for being here. Where can people find you? And if someone's saying, I need this, I really want to order a Mira kit?
Yeah, so clinicians have access to a onboarding process with us where it's no commitments. You just attend an educational call with us. We go through with our clinical team what you could use it for, how it could fit into your practice. And if at the end you're like, this is a good fit for me, then we'll offer you a free sample to trial on yourself, a patient, a family member, whoever wants to get that firsthand experience, what it's really like. And again, we stand behind our product. That's why we want you to have that firsthand experience. And then you decide where you go with it from there. Some practitioners, of course, incorporate it into packages, some list it on their website. You decide where you take it from there.
Absolutely. Well, it sounds great. And I would love to see the day where this is at a CVS or Walgreens right next to
We
the
would
home
too.
pregnancy kit.
Right now, to get Mira, it's no prescription. As we said, it's a direct-to-consumer product. The website's miracare.com. You can go look
Okay.
it up. But for clinicians, again, we have a separate website where we have all
Okay.
of our research and case studies, and you can book calls with us. We do clinical roundtables with experts like Dr. Carrie Jones. So again, to get access to all of the clinician side, we'll have to put it in the show notes for you.
Thank you. Thank you so much. This has been such a joy to talk about this and to be with you both. Thank you.
Yeah, thank you.
Thank you.